So Emma, what are some of the common misconceptions that you hear around endometriosis?
Well, I'll give the common misconceptions and Shaheen can give us the correct answers to what they should be. So, I mean, one of the most common ones we get is that if you have endometriosis, you won't be able to have a baby. Shaheen, what's the real answer to that?
Yeah, absolutely not true. It is true that endometriosis could, in some women, affect fertility, delay getting pregnant. But most women with endometriosis will be able to get pregnant. Most of them naturally, most of them will have a normal reproductive life. So I think that's a very important one to get right. Often I hear that people, when they hear the word endometriosis or get a diagnosis, they think that's the fertility side of their life gone. That is not true.
And also we hear people say, another one is they get told they should get pregnant to cure their endometriosis. A myth.
Yes, that's yeah, absolutely. That is something that I would blame maybe the previous generations of gynecologists for. This is something that women were told maybe many years ago. That is not true. It is true, however, that during pregnancy, many women with endometriosis will have less pain. But that's often temporary. Endometriosis doesn't go away as a result of pregnancy.
And another one that I always hear, and I always am really sad when I hear this, is someone saying, oh, I want to have a hysterectomy. I'm told it'll cure my endometriosis. So hysterectomy is not a cure, Shaheen. Tell us why.
No, and again, maybe for each of these, I will blame someone. I think part of this is due to old misconceptions coming from healthcare professionals. And part of it is because of the stories we hear in the media from celebrities who have said that I had a hysterectomy to cure my endometriosis. That is absolutely not true. If you remember the definition of endometriosis, that's when the tissue that is supposed to line the inside of the uterus grows outside the uterus, and therefore removing the uterus doesn't make sense to cure the disease. Having said that, when you have the abnormal tissue growing inside the muscle of the uterus, that's called adenomyosis. And adenomyosis and endometriosis can coexist in up to 50% of women with severe endometriosis. And in those women, if they've completed their family, a hysterectomy may be appropriate. But certainly the treatment for endometriosis, if surgery is required, is to remove the abnormal tissue, which is outside the uterus, not to remove the uterus.
Yes, adenomyosis is another issue we've not touched on today, but yes, that's a different one, isn't it? And one of the things that we also hear, sometimes people get concerned, and I've seen it written, is that if left unchecked, their endometriosis will just carry on growing. So Shaheen, again, what's the real story on that?
Yes, that's a difficult one because the evidence is not clear on that. We think, and it's likely, and I believe, that endometriosis in most cases can be a progressive disease. But that word can also sound scary. We think of cancer when we hear progressive disease. We think it can metastasize to other distant organs. It's not really like that. There are exceptions. With endometriosis, we can never say never. Those things can happen very rarely. But we shouldn't be too concerned about rapid progression of disease. Although it does happen, it's rare.